My name is Dr. Kevin Pecca. I wanted to make a podcast that exposes people to the true miracles of life and health. All the guests on this show have been specially picked because they bring something positive to the world. They have some of the most amazing and inspiring life stories. These people have a passion for living, healing, and leaving the world better than they found it. There is something inside these people that made them keep fighting through all the tough times, even when people told them it was not possible. They carried on and made their lives beautiful again. And now they are sharing their experiences with the world. This is the Expect Miracles podcast. Enjoy the show. Dr. Ryan Dawson is a chiropractor out of San Jose, California. Today on the podcast, we will be talking about things that are good for the soul: hiking, camping, getting outdoors, eating right, exercising, and improving the quality of everyday life. Please welcome Dr. Ryan Dawson. All right, so today on the podcast, it's an honor to have Dr. Ryan Dawson back on. He was one of the first people I had on the podcast. If you want to check out his previous episode, it's called A Psychedelic Experience with Dr. Ryan Dawson. You get a little background on where he's been and how he came to be the doctor he is now. Always a pleasure talking to you, bud.
It is so good to see you, Kev. I'm really excited to jump back on here and get down to work and get down to business and talk about what we do and how we're going to get it. Whenever we get stuck in those ruts, like just kind of feeling stagnant, feeling like we aren't getting our messages across, especially as chiropractors, we're up against a lot.
Yes, absolutely.
We're up against a whole community of not only medical doctors that may not know what we do, but we're up against so many people out there, patients that literally I'll go out and I'll do a screening and I'll be like, oh no, sorry. I mean, I'm sure we've all heard this, but it's like, I don't believe in chiropractic. And I'm like, absolutely perfect. That's great. Because I don't believe in anything that hasn't worked for me or that I haven't tried yet either.
Right. I was literally talking to Kevin Fisher. I had him on the podcast episode. And I love when people come up to me and be like, oh, you do chiropractic? I don't believe in that. And I was like, well, that's pretty funny because it's not a religion.
We got a whole practice here out of non-believers. So I'm actually trying to build my practice out of people that have no idea what it is.
Oh, yeah, it's great.
And every once in a while you get lucky and you get the patient that comes in. It's like, you know what, doc, I just want to take care of my back.
Yeah.
And I just want to make sure that I do whatever I have to do so that in the future, this doesn't bother me. I'm like, ding, light bulb comes on. I was like, okay, who are you and where are you from? Because it's amazing. We need more of that.
Oh, absolutely. Patient education's huge.
Absolutely.
Sometimes I'll slip up and forget to tell somebody something and got to reinstill it every visit. Like, this is healing is a process. It takes time and you got to be in it for a long haul. So
I couldn't agree more. The thing is kind of the difference between this episode and last episode, right? I can't believe it's already been a year. First off,
it's been a year, right? What?
2017 was a little bit crazy.
Yeah, definitely.
And I got to listen to Fish's podcast, so that was good. It was nice to hear his voice. It'd be awesome to see you guys again sometime out here. Hopefully we can get you both out.
Well, I'm going to be out there at the end of April.
Oh,
so
wow.
I will see you. So me, Timmy, and Liz, we're hopping in a van and we're going up the coast to Vancouver.
What? You're going to be passing right by. I'm in Santa Cruz now.
I know. So meet us in the Redwoods.
Awesome. Now, I live in the Redwoods. I live in a little shack cabin that's like deep in the Redwoods. It's been raining there for like a few weeks now. I'm not really quite sure how do I even get home. I might have to take a raft or something.
Dude, that place is magic. Like, just upon entering the Redwood Forest, there's something that kind of takes over you that you're like, this is one of the most magical places.
Isn't that so true, though? Like, there's like this mysterious, magical vibe whenever you just kind of get in there and you're like, all right, these are some ancient, just mystical trees that obviously have some kind of balance to our ecosystem.
Absolutely.
And this whole area, like everything about Santa Cruz is like, it kind of has like that like rustic, like backwoods, rednecky. Like, it reminds me of home.
Yeah, if I was to live in California, I would definitely go to Santa Cruz, Santa Barbara area because I love it. It's different. It's completely different than Southern California. It's different than like the San Francisco vibe going on. It's just got its own little thing.
Absolutely. And I live about 45 minutes from San Francisco. So I've been up there a couple times. It's one of my favorite cities. I actually like that a lot more than LA now, even though I love LA. I'll never feel bad towards that city. It's like, I can't do it again.
No, it's weird.
It's out of there.
It's a crazy place. Honestly, I don't even think it's a theory, but I don't think our bodies, like us as humans, are designed to live in the type of environments we're living in now, where you're sitting on the freeway for hours out of the day. You're so much stimulus in front of you constantly, whether it's advertising, billboard, cars whizzing by you. So I think every time you get to go to a place like the Redwoods, it's therapeutic. It's unbelievable.
Absolutely. Take a step back. take a step back, gain some perspective, and really just try to reconnect with not only the nature, reconnect with yourself. And that's one of the beauties about living up here. I really like living in Santa Cruz. As you know, I was in Santa Barbara for last year, and I love Santa Barbara. It's always going to be my little slices of home, but I had an opportunity back in October, actually. So it's been about 6 months now. And yeah, so I came up here and I'm working in a correctional-based chiropractic office, and we do a lot of workshops. So as you said, patient education is crucial. And that's one of the things I've been doing more of this year is my workshops. Tried to get better at my referral statements. I want it to be passive. I want the practice to be passive. Every time it's like breathing. Whenever a patient leaves, they know that they just had an amazing product, an amazing adjustment, amazing experience. They just got all the love in the world in that little amount of time. And then all of a sudden, that little thing, just going a little bit extra and giving an awesome adjustment, but also giving them the love and the passion and say, hey, put your hand on their shoulder and say, hey, wouldn't it be awesome? Like, wouldn't it make more sense looking at your x-rays? And if we could help your friends and family out before they got to a point where you were, wouldn't that just save so much time and so much effort and money in the long haul? And that's what we're really trying to do here is build a community and be that safe in the community, right?
And I feel like that takes care of itself. Like a lot of people come in, you treat one person in the family and they get better. And then before you know it, the whole family's in the office. Or you have the other people that bring their family members in and they're kind of just watching you to see what it's about. Because it's almost like they want it for themselves, but they're sending somebody else in first to like, see how it goes. And then once you help them out, they're like, I love seeing those patients because it's almost like right after you adjust it, their family member, they come to you like, listen, this is what I have going on. And you're like, all right, this person wanted it from the beginning. They were just trying to see what's going on.
In the beginning, they're like, yeah, I have nothing wrong with me. I've never had back pain in my life, never had a problem in my life, never been underneath any stress. But as soon as like they see what's going on and it's like, okay, there might be something to this. After all, I did kind of have this little twinge in my neck. And when that happens, I actually push them back a little bit. Instead of running and jumping at every single person that's like, I need a chiropractor, come back a little bit and be like, okay, still have to do the exam. We still have to make sure that we are doing everything because that's where we really build our significance. At least here, we build our significance in that exam. We don't even adjust on the first day. We do day 1, 2. Sometimes I will adjust on the first day if somebody is just like an acute pain. I had a guy coming in here last week that was just crawling in, big old football player. Guy could barely walk. And then he comes in, gave him a great adjustment, and he went and worked a double on that Sunday. It was Saturday. Comes back on Monday, he's like sore again, can barely walk, and he's back in the same state he was on Saturday. Another great adjustment. Never saw the guy again. There's a disconnect there between pain symptoms and understanding that what you have going on has been there for years. For a lot of these people, it's like getting them to bridge that gap of this is how I currently feel and this is how it began. And this is kind of we're in the same body that we've always been in. Sometimes the pain is there so quickly and it leaves so quickly after a great adjustment. There's a disconnect. They almost forget that they were in that pain and they had that experience.
Absolutely. Yeah, they'll come in like a year later.
It's like, yeah, come back and he's like, I think I'll be okay. It's like, wait a second. 2 days ago, you were barely walking and now you're like, okay, I'm good to go back to work and come back whenever it's bothering me, basically. And that's the opposite of what we're trying to do. We're trying to really get down to the reason, right? The why. And I think that's why we...
The root cause, yeah.
Exactly. Getting down to that and making sure that we get back to chiropractic. And that's something that I had to kind of relearn over the last 6 months was I got so far, and I love it. I love science. I love getting into that. But I got to realize, and I got to remember this on a daily basis, information doesn't get people scheduled. So just like giving people all this information that I think is awesome, sometimes it goes over their head. It's like glutathione. Like, why am I telling my patients about glutathione? Like, I'll just go ahead and give that to them. Same thing with the exercise prescription. I was so big on exercise. I still am. But now I value the adjustment so much more. I'd rather give a specific correction, go home, and you do the exercises there. And we'll give you some supplements and a list of things that we have them already pre-packaged. They just buy the package and then they just open up that package. That's their morning capsules and then they take those and they're ready to go. It's got probiotics, got your anti-inflammatories, got some antioxidants.
How often do you supplementation with your patients? Do you have everybody on supplementations or is it only for certain types of people? Or
I'll be honest with you, Kev. I talk about it with all my patients, but I don't prescribe any supplements anymore. I don't get lost in it. I don't try to get lost in the supplement game. I don't get lost in the physical therapy exercise game. And as awesome and as amazing as they are, I realized that it didn't set me apart from a physical therapist. There's no difference at that point. So I needed to remember what my niche was. And my niche is supplying a specific chiropractic adjustment to an area that shows spinal degeneration. They have nerve conduction that's not working the way they're supposed to. And it's just getting back to that basic concept of you are going to be better off no matter what your religion, what your race is, what your sex is, what your diagnosis is. You're going to be better off and more well equipped for the stresses ahead and whatever life has to throw at you if you're well adjusted and you're in alignment and you're clear and you're brought back to center.
Absolutely. And that's what it's all about.
I don't think anything can bring you back to center and into that moment and bring that mind-body connection back together than a chiropractic adjustment, especially.
Absolutely. Well, I mean, specific chiropractic works. If you're doing specific chiropractic, you're going to get results. And I'm very skeptical when I walk into an office with a lot of gimmicks. Like they got all the supplementation on the walls. They have all the PT workout stuff over there. They have everything. And it's like they're doing everything else but chiropractic. And when you have specific chiropractic and you're hitting the right spot, that's really all you're going to need. It's not all the patient's going to need, but you know you did your job, and then you can refer them to a physical therapist down the road or just refer them to certain people. But if you know exactly what you do and you do that well, you can't be stopped.
And that's what we're doing. I don't want to think that I don't have time for them or have to refer them out to a PT. That's why we do the classes and the workshops after the shift. Because whenever they come in for an appointment, I want to be focused on finding that area that needs correction.
Yeah.
Give a specific correction, and then that's it. And then they come to the classes later on in the week. We'll go over their exercises then. We'll talk nutrition and stuff then. But when they come into the practice and they lay down on that table, we're all focused on getting that correction and making sure that that's what they get exactly what they need on that particular day. And then all of a sudden, I start having more fun with that because
it's so much fun.
As you know, like whenever I got out of school, I wanted to tell everybody everything I knew. And I wanted to do every single thing on every single patient that I learned. So I'm over here doing like heat and E-stem and doing like 5 different muscles of myofascial release before I ever adjust. And then all of a sudden, the patients are like, oh, wait, are you going to do that thing to me again? And it's like a normal visit turns into a 30-minute visit.
Yep, whereas you got to be careful of that, yeah.
Now I come into the room, I give them an acknowledgement. I say, hey, Mrs. Jones, it's awesome to see you. So glad that you're here today. So glad that I'm allowed to serve you. And I didn't know if you realize this, but we've been serving your family for over 5 years now. Over 5 years, isn't that amazing? I mean, who else can you tell about your amazing story? And then that's my referral statement. And then all of a sudden, down to business, it's like, okay, let's find out what you need today. Give them a nice adjustment, clear it. And then all of a sudden, that's the groove right there. And that's the meat and potatoes. We're setting the table whenever a patient comes in. It starts when they walk in the door. It really is a lot of theatrics. I'm not trying to tell you or anybody else how to run the practice, but I feel like for me, the whole thing that I've gained in my knowledge over the last 3 months is my energy and the passion in which that I talk to my patients and making sure that it's not just another adjustment. It's not just another visit. We're not just blending in. We don't want to blend in our communities. We don't want to blend in our visits. Every time they come in, it's amazing because we got to remember all this crazy stuff that's happening in our societies. All these school shootings, all this other stuff. We got so much distortion in our society that we need to be the safe haven where people can know they can go, they can get an amazing product, an amazing adjustment. They're going to be around people that love them more than anything. They're going to be around other people with amazing stories that are uplifting them. And then all of a sudden, this becomes a place where this can be their tribe, right? Like we're tribal beings and we need a tribe and we all have spines. So why not make that our connection, right? That's kind of where we're at right now. And being able to inspire and stay inspired is really important. That's one of the things that I always have to have. Because like I said, the energy, we got to stay up. We got to stay up.
Well, and that comes from you taking care of yourself too. Like you can't be your best doctor if you're not eating the pudding that you're saying to all your patients. So I'm sure you get adjusted on the regular, making sure everything's turned on. And so you can be the best doctor for your patients.
Absolutely. Absolutely. I try to be the very best for my patients every single day. It really does start. It starts with my mindset in the morning. Sometimes I'll listen to a podcast on my way to work, driving, just getting that set.
That's huge. I think you set an intention every morning, and it doesn't have to be like the huge, long ordeal. If you take like 5-10 minutes every morning, say what you want to get done that day, your intent. I have way better days than when I just wake up and go to work. If I take 10 minutes to myself, I plan out what I want to do, say what I'm like grateful, thankful for, and then get on my day. It goes way better than when I just roll out of bed and I go right to work.
Right. And then usually what happens when on the second part is like you roll out of bed, go right to work, and then you end up hitting every single light on the way. And there's a tree down and some
It's a domino effect.
Squirrel was like chewing on the power lines over there, so the light doesn't work. And it's like all these things start happening. It's like, damn, if I would have just got up 10 minutes sooner. But you're absolutely right. You got to take care of yourself, especially when you're adjusting 50, 60 upwards. Monday, I adjusted 110 people. So my doc, he's out right now. He's on vacation in Hawaii. So
he's got you doubling up.
Running the show, getting lots of practice, getting lots of adjustments in this week. And it's awesome. It's awesome getting my hands on everybody. Now, I'm on a mission, Kev. I'm on a mission to save the world one spine at a time.
There you go.
And I feel like that if we have our intentions set, we recognize those things. And the most important thing for me over this last year was not only just the energy, but understanding that I don't have to do this all myself.
Right. No, that's huge.
I thought that was like, no, I want to go into my own practice. I want to do all these things. I want to go ahead and start and be like Dawson chiropractic across the front and basically start running before I could even crawl. Kind of bit the bullet on that. And I was like, all right, I'm going to get coached. I'm going to be open to whatever they have to say. And I'm going to go ahead and get started on being a team player. Because whenever we have a chiropractor trying to be the chiropractor, trying to be the front desk, trying to do the billing, trying to be the CA,
takes away from the chiropractic.
There's no way you have the energy to give that patient what they need and also the love that they need. And it's multifaceted. You have to have that team approach. Whenever you surround yourself with a team that everybody's on that same goal, it seems like we get so much more done. And it's like, why did I spend so much time trying to do it myself, having that team around you?
I completely agree. My office is set up. My front desk woman, Maria, is an angel. She is so good at what she does that literally all I have to worry about is adjusting people, and she takes care of a lot. I also just hired my cousin. So I think it's very important to surround yourself with people that are going to help you and have common goals, and it just makes the business run way better.
Getting back to that idea of not having to do all the stuff on all the patients on every visit and be the doctor, the CA, the biller, and the marketing people all at once. It basically, like, it makes your world so much easier and allows us to focus on what we need to do and focus on making on that spinal correction. Exactly. Getting back to the basics of what we do, getting back to a little bit more of the chiropractic side. I'm having more fun treating that way. I'm having more fun talking to the patients and getting them really stoked about their adjustment. I may only adjust 1, 2, or 3 segments that day. I'm not just doing full spine, flip them over, racking them and cracking them all day. It's like, I'll tell them what they need this for, build it up, give a specific, really good one. And then that went perfectly. That's exactly what you needed. Pat them on the back, say, see you on Monday. And then all of a sudden they're like, wow, that was an amazing, amazing experience versus like trying on every single vertebrae on a single spot, trying to chase the crack noise, trying to chase the popping sound. And if it doesn't go once, the patient's like, whoa, what happened there? Like, I don't even double shoot anymore.
Yeah. Well, the whole thing with that is, as we both know, it releases endorphins. When you go after every bone, every crack, it's going to feel good because it doesn't release those initial endorphins. But the question is, how is that patient feeling 3-4 hours, even the next day later? Are you adjusting the same exact thing on them every time, or are they healing and getting better? And I think what you're saying with the specificity, I think it goes so much longer because you want that to hold and go to something else where you can really focus on and get that person better rather than twist, crack, pop, go, twist, crack, pop, go.
Absolutely. Absolutely. I think that is exactly where we need to be as chiropractors. And I don't think I'm specific as what you practice with your upper cervical, but I try to build it up that way. You know what I'm saying? To the patient. But I'm also using the x-ray, using my exam notes, and then getting it in there and being specific. But let's move on. Let's go ahead and get into some of the other health benefits of what we have around us in this beautiful, amazing world, especially here in Santa Cruz. We have a lot of medical cannabis. So this is something that's on the rise, and it's something that's warranted to talk about because it's here.
I have a question for you, Dr. Dawson. So when you have a person that's like got some really heavy chronic pain, even if it's like really acute, can you tell that person legally, oh, why don't you maybe go to the dispensary and pick this up for your chronic pain, or how does that work?
I don't ever make prescriptions like that, but I will mention I have several patients that do take the CBDs, cannabidiol. Yeah, the cannabidiol. I mean, you can get that at the Whole Foods and the grocery stores now out here. But yeah, absolutely. You know, a lot of my patients are already medical patients.
Yeah, very true.
They'll come in smelling like they just burnt one down in their car before they get adjusted. I was like, which one is that? Is that sativa or indica? What's going on here? And I can tell by the blood in their eyes that it was clearly a sativa.
My question is for a lot of people, what is your argument against it? At this point, with all the research, what we know now, with chronic pain, muscle spasms, seizures, the neuroprotective properties it has with concussions, they're saying. What else we got? Some people even say it's stopping cancer cells from spreading. It obviously decreases inflammation. And then you also have that psychological component where it's helping a lot of war veterans with PTSD. It could also be very introspective on yourself to figure your own stuff out. So what is the argument here? Like, what are we talking about?
You just covered so many great benefits that I don't even know where to start, but it's true. It's true. And one of the main reasons why cannabis is such a great component for our health is because much like chiropractic, it's a modulator. It can go in, and if a neuron is firing too fast and it's over releasing some neurotransmitters, say dopamine, then the CB receptors, they're going to modulate that. They're going to slow it down and have a more rhythm, a better frequency to that release of those neurotransmitters. If it's too slow, it'll pick it up and speed it. So it basically helps modulate. It doesn't speed up or slow down. It's really based on whatever that component needs. And then the side effect is better function, just like restoring proper dynamics to a vertebra.
Absolutely.
And then all of a sudden, that nerve has free motion. It has free conductivity to the organs and to the other tissues of the body, from the brain down and out. And all of a sudden, it's able to modulate itself better. So really, cannabis has all these benefits, but it's also helping the body help itself. I'm saying it's helping the body get back into a prime state.
We have those receptors in our body, right? Like it literally latches out. Do we have cannabinoid receptors in our body that it literally can latch onto and help regulate things? Is that right?
Yeah, we have two different ones. We have a CB1 and CB2 receptors. So the endocannabinoid system in our body, it's actually built in there already. And that's why cannabis can actually be stored in the body for so long, because unlike alcohol, if you take too much, your body doesn't try to eject it. It doesn't try to get rid of it. It actually stores it, stores it in fat cells. And the CB1 and CB2 receptors are really good because those are outside of the cells, and they help act as those modulators, especially in the nervous system, especially for modulating the pain gate pathway. So that's why not only cannabis being great for pain, but we know a lot of the pain pathway is regulated by serotonin. So whenever we look at serotonin, it's like, well, what's that also doing? It's regulating our mood. So, of course, there's a high correlation between depression and pain. Almost about 30 to 80% of people that are in chronic pain have depression. And most of the people that are chronically depressed have some sort of pain. So there's really a lot. There's no way to, it is a vicious cycle. And it's hard for, once you're in that cycle, to see the light and try to step out of that. But combining medical cannabis, first off, I don't want anybody to ever be dependent on anything.
Right.
I don't want anybody
very true.
to be dependent on drugs, on chiropractic, anything other than the love of their family and spouse and just being a good person. Like, that's what they should depend on, and then everything else will fall in. But from time to time, that is required, and it's required to get the adjustment. It's required to take care of yourself. So absolutely, I think that there's tons of benefits to this medical cannabis. The CBD is way ahead of the game as far as its benefits. One of the problems, though, with the whole medical culture and the culture of this, especially in Santa Cruz, is sometimes you have people that are excruciating pain, that have never gotten a glimmer of hope from anywhere else that they've went. And this cannabis is like first thing that's finally done anything. On the other side, we have people that are kind of like maybe just turned 21 and
they're abusing it.
That's going to come with anything, right? But at the same time, that's one of the problems with it, right?
With anything, you're right. And it's funny that you brought it up before, a lot of people say, oh, I don't do drugs, or I don't do that. It's like, really? How many cups of coffee did you have today? Or like, what's that Ritalin you're taking? Or there's just like, people think they're not taking anything, but we're all medicating ourselves in one way or the other with stimulants, going the other way with it, just trying to relax. There's a huge opioid crisis that obviously we both know of. And it's in one form or the other, everybody I feel like is doing something to peak performance or calm down or do something, whether it's legal or not.
And, to kind of tie back to what we talked about in the previous episode, kind of what you just said is everything like a experience, meaning that everything is, and to break on that word again, psychedelic comes from the Latin term psyche, which is mind, and delos, which is manifesting. So it means manifesting the mind. And that means that every single thing that we take in from our outside surroundings and our world, this universe around us, and within us is all being conducted through this nervous system and being integrated through this system. And that system is highly regulated by biochemistry. So the drugs act on the same pathways as the neurotransmitters. So a lot of these drugs are meant to mimic the job of these neurotransmitters, and basically they don't have a very good feedback mechanism. So they end up flooding the brain and all the serotonin, and people kind of get lost in like this vicious cycle of symptomology and coming out of being depressed and then take their pills, or having an exit strategy off those things. And I have patients come to me all the time and they're like, "Doc, I've been everywhere. I've tried everything. Been to this, and this specialist, done all these things." And you just get passed around. And all of a sudden it's like they got a laundry list of drugs. And it's like, okay, let's just get back to the basics. Okay, let's get back to figuring out how you are teaching your body how to move properly, freeing up areas of stagnant energy in your nervous system, getting you on a well-rounded whole food plant-based diet, getting you to take some anti-inflammatory supplementation. So the CBD, combining that with THC works great. Turmeric, I talk about all the time with my patient. The antioxidant support, going in supplementation a little bit, but the glutathione is the regulatory master molecule of all the antioxidants. So that's the master antioxidants. We go into the supplementation, but I don't want people to depend on it. Be like, yeah, if I take magnesium, I don't need to come and get adjusted. It will help. It will help. And the same with the medical cannabis. This will help. It's a better option. It's just a better option, and it's got a lot of benefits to it. And there's a lot of benefits to the CBD. And I feel like that's the future whenever we're combining it with some new information coming out and actually being put on the ballot to legalize psilocybin mushrooms. Some of these mushrooms, and especially the shiitake mushroom, the reishi, and the lion's mane in particular is a medicinal mushroom that has been shown to cause neurogenesis, especially in the periphery. So you take your lion's mane, and you drive that home with strong anti-inflammatory support.
So is the lion's mane psychoactive? Are those magic mushrooms or no?
No, those are I feel like every mushroom does have some kind of medicinal benefit, but lion's mane is not a psychedelic. The reishi mushroom is really good for immune support, really good for helping your body adapt to stress. And it kind of acts as one of those modulators as well. And then going into all the different little more edible medicinal mushrooms like the shiitake mushroom, those are going to be really good at just boosting the immune system and also helping with those neurotransmitter connections and being able to regulate our systems better. And getting into where this is all going, it's like, I really see a future of integrating psychology with physical medicine because there's so much overlap. It's like, I've had a couple of patients where I adjust and right off the bat, they start bawling. And I'll ask them, I'm like, holy cow, what happened? Are you okay? And they'll, yeah, I'm fine. That was awesome. And I felt like I needed to cry afterwards. So it's like, sometimes you have this huge emotional release because it's stored in the body somewhere. So there's a psychological component too.
And you can take it the other way too, where people go everywhere else and they're like, other doctor's not listening to me at all. I tell them what's wrong. I feel like he's not paying attention to me. And then they come to your office and you kind of just listen to them for 5 or 10 minutes. And sometimes that might be all they need that day, just to like have somebody hear them out. And that goes a long way.
You just hit it right on the head, my friend. That is it right there. You got to be able to, and that's a problem. And kind of having this idea of going around to the schools and implementing some kind of course where we teach kids and students good bedside manner, like how to really when we're going through school, they teach us all the, LOPQRST, all that stuff.
Yeah.
And it's really good for the history taking, but it's like, okay, you got a lot of pain. Okay. Where is that pain? It's never like you
can't be a robot.
It's like, wow, you are in a lot of pain. I can see that. And it's been going on for so long. Like, this is insane. And so just being able to take it a little bit extra, just a little bit far and really dive in and be empathic and listen.
Oh, absolutely. And then you give a nice adjustment after all, everybody wins. Everybody's feeling good.
Absolutely. Absolutely. And that's one thing. We're trying to build a team around these patients and make sure, because I firmly believe that you are the equivalent of the top 5 people you hang out with.
Oh, that's huge. Who you surround yourself was who you become, definitely.
Absolutely. Absolutely. And practice. It takes practice. You got to practice being positive. You got to practice being energetic. I have a mantra that I do in the morning. I've made this big picture and it's like smile, love, focus, and deliver a great adjustment and then expand from there. Really, that's my step-by-step process whenever I go into a room with a patient. Just like whenever I would get into a funk or something on the mound, I'd have to step off and wipe the dish clean and make sure that maybe toss in and get a fresh ball or something. But you got to be able to step back and get that fresh perspective so you can go right into that next person and give them 100%, 110%.
Yeah. There are some people that are like, you shouldn't feel that way or you shouldn't have any bad days. Like, it's yin and yang. Like, you can't have good without the bad. And if there's a lot of bad shit coming into your life, like, I almost like, well, I mean, I don't welcome it. I don't like it, but I also know that there's something better coming. It's all the bad stuff's coming and it's making way for the good stuff to come in. Because you can't have it without, you can't have one without the other.
Well, it's also like when everything's going good, that's when I start looking over my shoulder too. Watch out for that sledge. It always happens. As soon as you think you got to figure it out, life kicks you right in the.
Well, that's what that mantra where you just said comes in huge, because there's days you probably wake up and you're like, I'm not feeling it today. And you reading that, putting yourself into that good spot or zone, it helps you set the tone for the day, even when you weren't feeling as good as you thought you were going to do.
Absolutely. Absolutely. And part of that is I work really hard and supply great energy. But at the end, it's like you said, you got to be able to take care of yourself and get back and reconnect. And that's one of the reasons I love living up here in Santa Cruz. And one of the reasons I love being in California is it's so much variety and being able to connect with nature.
It's unreal where you live, dude. It's like, it's perfect. It's perfect.
There's a lot of opportunity. There's a great opportunity to go around and explore. I mean, it's an amazing thing. And it's really important. It's so crucial that we get back in connection with nature, not only from political standpoint when we're talking about all these global warming, but also just individually being able to take a step back and go for a hike, get your heart rate up, get some fresh air, be able to clear your mind, active meditation, and basically re-immerse yourself in nature and kind of get out of your head for a second, get some fresh perspective, take a step back, and then you're like, wow, this is amazing.
That would solve so many world problems. Like on a huge level, if everyone started taking care of themselves first and foremost. And I feel like we all innately know what to do, but it just gets crazy. Like life gets crazy, we forget, and we do a lot of crazy stuff. And I feel like you got to take that time for yourself.
Absolutely. Absolutely. I totally agree. But what happens? And we end up in these cycles of getting stuck, right? So we'll get stuck, we'll stuck in a rut, and it's all of a sudden, it's almost like whenever I'd be hitting. And it's like you go up to the plate 20 times in a row and it just seems like you can never sniff the guy at all. Like you can't ever even put the bat on the ball, can't even get a foul pitch. It's like, what am I doing wrong here? And it's like the more it builds up, the harder you try and the harder it gets. Like usually when that happens, I start to get that feeling.
Well, dude, that's perfect right there.
Really been trying to control and be better about the reactions, right? Being better how we react to what happens to us, because I feel like we're an accumulation of not just the things that happen to us, but majority of how we react to those things that do happen to us. So how to control our reactions and how to not go based off that first instinct as soon as something
Absolutely. I mean, do you think that a lot of people just almost shut off that gut feeling? We're all throwing roadblocks. Some are more major than others, but I feel like there's people that will just be like, they'll turn it off and like, it's going to get better if I just keep doing this. And they kind of ignore it. And there's other people that once that they get that gut feeling that something's not right, or they'll listen to their gut and it takes them on a completely different path. Do you think there's a lot of people that are just like shutting that off?
Absolutely. And not only are they shutting it off, but they're like actively shutting it off. And I've been that person too.
Oh yeah, me too.
You find that escape, and then next thing you know, like you think that whatever your escape is, it might be healthy for the time being, maybe a temporary relief or coping mechanism, but then all of a sudden that becomes what you're a slave to, like say so last year, right? Like I loved it. I learned so much, met so many amazing, great, awesome people at these festivals. But it's like by the time I got to the summertime, I've been to so many festivals, I was just like, kind of burn out on this. And like the thing that I was so passionate about at the beginning of the year actually became like this like other social thing where I was like in this like clique. Like all these people that I'd met at other festivals, and it's like, okay, I'll see you at the next one. It's like this spontaneous kind of childhood feeling where it's like, all right, I'm here camping out with friends and dancing and having fun. All of a sudden became like a routine. And I was like, I never want my fun to be a routine. And
yeah, no, absolutely.
Part of that is not working as much as I should have and playing too much. So you have to have that proper balance. You can't work too much and not play at all. And you can't play too much and not work at all, because there's a satisfactory feeling that is missing whenever you're at two ends of that spectrum. So you got to find that balance. And right now I'm right in the middle of that.
Yeah, that's good. That sweet spot, figuring it out.
Hitting the sweet spot, man. Knocking it out of the park. The pitcher just threw a fat hanger right down the middle. I just blasted it over the center field fence. 450, baby.
You still hitting the gym hard? What have you been doing for a little activity there?
Obviously, Obviously, dude. Look at me.
Just
look at my cheek,
dude.
Look at my cheeks. I've been going to the gym and doing a lot of smiles. I put some dumbbells right up here. My ears are getting bigger too. You see that? I got some ear flies. I hook them up to the cables. I don't go to the gym anymore. That's too boring for me. I mean, I love it there. I always have a connection with bodybuilding. I love going to the gym, but I've turned a page. I want to spend more time learning things that I haven't ever done before. I've been taking up time learning how to make music and try to be better about like reading more often, learning new things. You're making this life about and not necessarily being good at one thing. That's one of the reasons I'm so happy. I feel like not making it to the major leagues was the best thing that never happened to me, because I would have been so one-dimensional, right? Like that would have been all I known and all I did really up until this point. Whereas now it's like I feel like I've lived 2 or 3 different lives already. And I still have plenty of time where I can do this amazing thing that I love already. I feel fortunate to be a chiropractor at the age I am, right? Just getting started. But in 20 years from now, you never know. I might go on tour like a little bluegrass band or something like that.
Sign me up. I'm in for that. I'm in for that.
Bring your harmonica out, man.
Got the harmonica. Pick up a little banjo.
We'll have a good old hoedown.
I'll bring you to the Redwoods in a couple weeks.
We'll get Santa Cruz hoedown. That's right. It's going to be good. I'm really excited for what the future has for us. I'm really excited for not only where we're going as a collective, but I'm excited to see what some of our other classmates are doing too. And kind of peculiar to me that we have people that we work so hard with in school that aren't even practicing right now. It's sad to me, but it's also like, I feel like if you know something's right and people in your environment and community are misinformed, I feel like you have a moral obligation to get the word out there and tell every person that you can with every amount of breath that you can for the amount of time that we're on this earth, to tell them the truth and tell them that you don't need to take these drugs. There actually is an alternate path, and the alternate path isn't alternate to health. It's alternate to the mainstream, in which has become very unhealthy. And this is where we're at in our society. We got diabetes, heart disease, cancer, obesity, autoimmunities. A lot of these things are coming from they're a chronic lifestyle-based disease and dysfunction, and we know that. And that's something that we probably knew going into chiropractic school, and we drill it home and around all these people that believe the same thing and they know this stuff. And then we get going back out into society, and it's like some people forget that, yeah, you can't eat a bag of Cheetos every single day. Like, I know they're delicious, but it's like getting back to the basics, the very basics. And I feel like we have a moral obligation to do that, to tell people that they need and teach them how to take care of themselves and not spend too much time getting wrapped up in how their office looks or how many patients they're visiting or how much money they're making. Money's awesome. It's a byproduct to great service. And I've made more money this year than I have in my whole life, any year of my whole life. So I have the best financial year of my life. But it's a byproduct of good energy and great service. It's not a byproduct of me being salesy and insecure and hoping that a patient's going to walk in the door.
Right. Well, if you put the money as the first thing, you're missing the point. It's going to be a long, miserable haul for you if that's what you're putting first with pretty much anything.
And I'm not afraid to talk about money, to talk about finance, because part of health. Financial health is a branch of health for me, and it adds to people's stress. So teaching some of our patients, and part of what we do is talk to them about managing their lifestyle. And part of that goes into managing savings. It's like we have patients that are 60, 70 years old that have all these medical bills at the end of their life. They don't have any, they didn't save for retirement. They didn't save for their health at the end. So it's like, geez, that's such a crucial aspect. Now, I know money is not the most important thing, but it does extend our reach. It allows us to get the services that we need later on. So it's so important to save and to be smart with how we spend and invest back into our communities, back into these local farms, and start rebuilding as if our dollar is our voting ticket and how we cast our vote.
Well, dude, I think a lot of people have to turn off the television too. I think a lot of people need to turn the TV is poisonous.
The phones too.
Yeah, the phones are bad too. But I mean, there is a lot of good stuff. Like, we are very fortunate where we have access to all the information. Like, YouTube is so phenomenal where you can just watch a video on how to learn anything. And the information's out there. It's just you got to put your head in the right spot.
Tell me about it. I mean, YouTube's so great. I made like the best double PB&J the other day. I didn't even know that existed. Didn't even know it existed.
Dude, there's a YouTube video for everything.
Peanut butter on both sides of the bread. Peanut butter all over my fingers at the end of the show. Like, who would have thought? Who would have thought?
Yeah, man.
YouTube.
All day.
There's some sensations out there.
All day long.
Yeah. So basically getting out of these ruts, getting back to the basics, getting back to what makes us human, getting back to what we are. And I feel like at our deepest level, and part of this has come from my life lessons. Some's come from people I've talked to, and some's come from psychedelic experiences. But I feel like at our core, what we are is love and energy, right? So being able to ripple that out and have that vibration sent out into the universe, we can directly affect our communities just by being more positive and being loving, and then being the best listener / doctor in your community, and then also supplying the best treatment in your community. I feel like chiropractors need to be like the Bruce Waynes of their community, almost like the Superman or the Batman. You need to know that you are a standout, and you need to know that you're the type of person that not only thinks differently, but you're okay with thinking differently, and you're comfortable with thinking differently, and you should think differently. It's a hindrance against your own life, and it's almost a sin against the universe to not do that, right? Like, we don't want to always blend in. And that's one of the biggest things, is trying not to blend in. Absolutely. Whenever we're at the grocery store, whenever we're at the gym, whenever we're just out a hike, challenge my patients, I challenge other people to just strike a conversation. Tell somebody, it's like, wow, I really like your bag. I really like your coffee mug. That's the coolest coffee mug I've seen this week. I bet you it has like great tasting coffee inside of it too, you know? Just working on that bonding. It could be on totally random, totally stupid, but it's better than walking up and being like, okay, do you have a chiropractor? I bet you need a chiropractor, right? Well, come with me. Let's go get you a chiropractor. No, like starting with that basic connection, getting back with being a loving person, telling people that you've had this going on. Well, why don't you come by? We'll get it checked out, give them a glimmer of hope. And then next thing they know, they're telling their friends and family about it. And I just had this really cool story of this baby. She's about 1.5 years old, and she's a little Down syndrome baby. She was constipated for 6 days. And she didn't go to the bathroom. Like, she just couldn't go. Mom was giving her pears, giving her apples, and went to the pediatrician, gave her laxatives. And I was just like, whoa, bring her in. Let's check her out. So I went straight down. She came in, went straight down to S1, S2. And I noticed it was just a little bit more firm than it should have been. A little bit, feels like that nice little squishy baby feeling like it's supposed to. So I gave it a nice 3 little pulses. It's almost like the pressure in which you would check a ripe tomato, and 3 little pulses down there. And guess what? 2 seconds later, poop everywhere.
No way.
Just everywhere. Like, she pooped her diaper right there. I'm not kidding. And that was amazing. The mom was stoked. And it's like, okay, so this baby has been on drugs and changing her diet just so she can go to the bathroom, when really it was just a small little blockage, the nervous conduction between her brain and her distal colon. It's pretty cool whenever we see those miracles like that. And we've had a few like that. We had one little baby, and part of what I really want to do is be better about getting these kids checked and making sure that they start a life in chiropractic, because we know that kids that are in chiropractic versus the allopathic model are just going to be healthier long term. They're not going to be on as many drugs long term. They're not going to be required to have as many interventions long term. They're going to have better relationships and better bonds. That's one of the biggest problems in our society. We think we want a quick fix for everything. We want a pill for everything. Well, there's no pill or like button for long-term relationships and bonds and long-term health and vitality. And that's part of something that we just got to get across and kind of just get down to work on. It's cool. It's cool whenever that light bulb turns on for patients and they're like, okay, wow. It's like, I was resisting a lot before. And I was like, yeah, of course you were. How many times have you ever been successful at something that you didn't commit to? It's impossible. It's impossible to not be committed to something or someone and get the best response out of them or that situation. So I don't want to go into relationships and everything like that on this episode. It's important to not only take care of your pain, because pain definitely plays a role in our relationships. If it plays a role in depression and our anxiety. So helping people understand that depression isn't a diagnosis, but it's actually a normal human emotion. If we didn't ever feel depressed or ever feel sad, that would be the same as not ever feeling happy. So we have to have the contrast in order to know where we're at and orientate ourselves. The problem is that we get stuck on one end of that spectrum for too long, and it's really, really hard to get out. So one way of doing that is, I feel like, and this is theoretical, okay, and this is like 50 years into the future, but I feel like if you could have an experience where a patient is working with a therapist, say a psychologist, and they take, say, MDMA or psilocybin, and they go through one of these psychedelic psychotherapy sessions where you take the drug and then you have the experience, spiritual experience. You come out of it a new person. You have your reflection with that therapist. And then right at the end, you get a really, really good spinal adjustment that kind of send that thing home. So it's almost like you're bringing that realistic feeling into the center, back into the moment. So you're taking what I just learned during that experience and then combining it with the present moment with that adjustment. And then at the end, you give them some of the lion's mane and some of these other supplements, and they're going in and they're restoring. We know that psilocybin has neurogenic factors. So you're rebuilding neurons.
What if you did the adjustment before to get the neurons already function properly, and then you take it, then that might be everything's functioning on the highest level. That might be something too.
It's already opened up. Yeah, no, that's exactly right. We might have to conduct a study one day and see which one might work better. I really think that that's it. We get back to being tribal. You have some good connection with whoever you're there with, your spouse or your friend or your therapist. And then you have some good rhythmic music that takes you out of your head. And then the drug kicks in. You have a self-loving, empathic feeling. Combine that with stellar adjustment. And then you get them going on this rehab program using medicinal herbs and supplements and mushrooms that actually go in and help the body heal itself on top of what everything else we're doing. And then there's no way that cannot be some kind of catharsis to that where you're just a different person after.
Right.
I mean, most people report being a different person after psilocybin anyway.
Right. It's just educating the people and teaching them that it's not dangerous and that it could be therapeutic. Because, I mean, we kind of touched on this the last episode. You mentioned any one of those things like mushrooms or DMT, and people are just like, what? Drug? Done. No, not for me. I'm not ever doing that. And it's just their brain shuts off before you even start speaking about it. So, I mean, it goes with anything else, just educating. And
well, it's a daunting experience. It's a daunting experience to know that you're about to go into yourself. You're about to face something that you probably have buried for years, maybe ever since your childhood, that it's affected how you developed, and you've been carrying that with you ever since, that your body literally has had that for so long that it clings to it because it doesn't know what other experience is out there. It doesn't know what's going to happen once you let that go. And you take a different perspective on an old problem, you have better feelings towards it afterwards. And there's this forgiveness that takes place, and you start to be able to move on with stuff. Yeah. That's a great therapy. And I definitely think that's one of the things that we're missing in our tribes. We don't have those interactions, not even with ourselves, but also within our tribes, within our communities. So that's something that, we have to get back to basics on as well. So our food that we eat, the way we socialize, the way that we conduct our behaviors and how we use those behaviors to actually stimulate our life on a physical level, on a mental level, and on a freaking financial level. Because that's one of the things I learned from a psychedelic experience too, is in order to be the person I want to be and have the impact I want to have, I have to make a difference. I have to extend my reach, and I have to serve as many people as I can so that I can keep doing it. I would love to eventually have multiple practices, but it's important to team up on it. Like I said, getting back and not thinking that you have to do it all yourself and telling that to the patient. It's like, you don't have to do this yourself. We are here for you and building an environment around you that's going to support you and give you exactly what you need and give you all the coaching you need on top of the product that's amazing. And at the end of this 3-month program, you're going to be a different person. And then you start adding in going on hikes, maybe trying to do some coping breath work or using medicinal cannabis, changing your diet, and then possibly under a controlled setting with the right environment and the right group of people, you could have a psychedelic experience. Or you don't even have to take the psychedelic to have a psychedelic experience.
There's different ways to get in there.
Right, exactly. So it's like just being able to reconnect and get and shed layers. Shed those layers so you can get back to you. Because a lot of times we get so caught up in our egos that we forget that like what we're trying to accomplish, is it really serving my future and my goal, or is it serving the ego and like a temporary type thing? So that's one of the things that I constantly deal with, is going from service and back and forth between that and you went to chiropractic school, you were a baseball player, you're doing all these things, you're an accomplished guy. I sit there and I'll tell myself that. And it's like, you got to remember, I don't know shit. The most important thing is once you realize that you don't know anything and you can just kind of be open to other people that allows people to open up to you so much more, because it's the most arrogant thing you can do is sit down in front of somebody and act like you already know what's going on with them. And I feel like that's one of the things I hear from my patients that have been to the medical doctors is they go into the office and they don't even look them in the eye. They don't palpate. They don't touch them. They don't really even converse with them at all. And then all of a sudden it's like, all right, so I have to get an MRI done. And the only thing that you can do for me is either a surgery and an epidural. It's like, I don't want to take those drugs. So what do? Well, there's no direction. There's no guidance. So they end up coming to us and it's like, okay, I have to explain to them what drugs they're taking, how those are actually interacting, because for some reason, the 5 different specialists they've been going to didn't ever communicate that to them. So it's crazy. The fact that it's like the baby I was talking about, having to take the laxatives before ever really checking spine. And then I have other patients come in that it's like they've been everywhere. And I feel so sorry for them because they're stuck in this medical mindset. And it's like, you're in this symptom-based mindset. It's like, you've been dealing with this for a long time and it's going to take a long time for it to get better, but it can happen. We just got to start with the right steps and go on the right path.
It would be very interesting if they came to us first, and if we couldn't help them out with something, then they tried the medication, and maybe then it would do something.
Absolutely. Not on my watch, though.
It's certainly not the case. I think there definitely is a place for medicine, especially like emergency. Like ER stuff is just phenomenal. But I mean, to have somebody on medication for very long periods of time, I think there's a better way to do it.
I totally agree. You look at some of these medications and it's like cholesterol medication, high blood pressure medication. They actually just changed the guidelines for blood pressure. So they lowered it 10 points. So now 30 million more Americans are actually qualified for blood pressure medication. They changed the guidelines for it and not necessarily anything else. We all know that proper diet, proper exercise is going to help regulate those things. So I think we're kind of beating a dead horse here, but this is it. And that you have to get back to eating right, connecting with the nature, connecting with the loved ones that you're around, appreciating the fact that you're even alive and you have an opportunity to not only be a great person, but you can actually help other people. That's an amazing thing. And I don't want to let anybody stand in my way of my destiny. I also feel like you're not going to miss out on your own destiny. Saying like so much time stressing about if you're on the right path or not. You're not going to miss out on your destiny.
It's going to unfold.
It's going to unfold. It's going to do it. What else you got for me, Kev? I love talking to you, man. I freaking missed you.
I know. I missed you too, brother. We covered mostly everything. That was great. Yeah, I think that's good. Yeah, if you want to just finish off with anything you'd like to leave the good people with, that'd be great.
Well, Dr. Ryan Dawson, I really appreciate each and every one of you listening to this podcast. I really appreciate you, Kev, for going above and beyond and allowing me not only to come on here and talk to you, but also all the other podcasts that you're doing. It's amazing. And I love that you're doing this show. I think that it's going to really proliferate into something truly awesome and just probably not even too long. I really think this is going to be a big thing.
Hope so.
I'm excited for you and I'm excited for everybody else. And I look forward to the next one. So if anybody wants to, they can go and check out my Facebook, my professional Facebook page. It's Dawson Chiropractic and Human Optimization. And you can follow that page. I'm going to be putting on some different talks and workshops, and some of them are mostly going to be Facebook Live. So I'm going to start doing it so that other people around the world and around the country can watch those. And I have done some of them, but not all of them yet. I'm actually working on having a little studio so that we can make it legit.
Beautiful.
And so watch out for that. Watch out for that. And I really look forward to getting you back out here and doing a little redwood romp around and
shake and bake,
play around, get lost in all the goodness, all the goodies.
I'm excited, man. Yeah, I'm coming out April 21st around there. So what days do you work? Because we're probably going to hit the redwoods like during the week.
Okay. I'm usually at work all day.
All right. We'll figure it out.
I have Thursday to play around. We'll figure it out. I'll definitely make time for you, man. There's no shadow of a doubt. If you're going to be anywhere in this vicinity, even anywhere on the West Coast, like I'm going to come hunt you down. I'm going to find you.
Well, Doss, thanks so much for coming on. You're the man. Appreciate it. It's been too long. We got to work on that.
I know. Freaking love you. And I hope you have a great rest of your week, Kev. I really do.
All right, man.
All right.
Thank you so much. Thank you, everyone, for listening. My private practice is located in New Jersey at Montclair Upper Cervical Chiropractic. If you have any additional questions about today's podcast, other episodes, or any questions about Blair Upper Cervical Chiropractic in general, feel free to visit my website at drkevinpecca.com or subscribe to my YouTube channel at Dr. Kevin Pecca. Hope you enjoyed the show. Cheers.